Hi everyone, I'm Dr. Amir Karam, board certified facial plastic surgeon. I specialize in facial rejuvenation, and today I've got an incredible treat for you. I am going to take you through the entire facial rejuvenation transformation process with one of my favorite patients. Her name is Brandi. She lives in Arizona. She came out to see me for a full facial rejuvenation, and she was incredibly helpful in participating in bringing all the inside information from pre-consultation to days after surgery to all the way through her entire recovery. This is an incredibly unique and rare opportunity to be able to see the inside of the facial rejuvenation journey. And without further ado, let's break it down. So I'm with Brandi. Brandi, tomorrow, surgery day, huh?
It's tomorrow.
So let's go over the things we're gonna do. First of all, how old are you?
I am 49.
49, it's like the perfect age because you're just starting to notice the changes happening.
Yes.
How long have you been bothered by them?
I would say the last about 5 years I've noticed it.
You've been noticing sort of some changes that are going on?
Yep, I've always taken really good care of my skin, but you know, I've used fillers and different things, but it just isn't lasting as long.
Yeah.
And so I've just kind of noticed that the last few years, everything's kind of coming down. And so I've been a little bit self-conscious of it.
When did you kind of make that transition from fillers and those type of things to the idea of having surgery?
Probably about 2 years ago, because I was pretty happy with fillers in the beginning.
Yeah.
And I started taking, Botox and all of that stuff when I was in my late 30s. And so I've taken really good care of my skin. So it did last for a while.
Yeah.
But after about 45, I just started noticing I was having to go more often, and then I almost felt like it was giving me more of a droopy look.
Yeah.
And so that's where I was like, oh gosh, I don't want to put more in because it feels like it's drooping more when it kind of starts to wear off.
So that's the thing I always talk about. When the laxity starts happening, when sagging starts happening, at that point, there's no point in fillers. Fillers is replacing volume, but it can't correct the sagging. And so you did the right thing before it got too far along. So let's kind of go over the combination we're going to do. So tomorrow we're going to do a full facial rejuvenation. Vertical Restore is going to take care of the laxity that we're starting to see happening in this area. And this is what you're noticing, right? This is all coming down this way. So the Vertical Restore is going to bring all of that right back up into position. This part of the brow comes up as well. And that's a very pretty effect that happens in the corner of the eyelid. We're gonna take out some of that extra skin on the upper eyelids, take out some extra skin and fat from the lower eyelids, and then we're gonna add the fat transfer in all sort of the right places. And that will bring balance and harmony to these areas of transition. And then to top it all off, we're gonna do a nice little lip lift, which will help shorten this distance in a very natural and beautiful way. I have to say, I'm gonna give you a ton of credit for is how great you've been taking care of your skin up until now. Brandi's been on the trifecta for the last 3 months, but I'm not gonna take credit for her amazing skin because you've obviously been doing great things for years prior to this point, but probably the trifecta has made it that much easier to be able to accomplish it.
And it's so much easier than not as many products. It's just quick and simple, and it does the job. I love it.
No, absolutely. When you have great skin and I get to do what I do surgically, the two combination, it's like pretty much you're gonna walk out of this thing, you're gonna look like you're in your 30s when we're done with you.
Sounds wonderful.
Yeah. I'm really excited.
Me too. Thank you so much.
Thank you. Thanks for doing this. This is the big morning right before surgery.
Yep.
You excited?
So excited.
Awesome. I love this attitude, by the way. This is exactly the attitude that one should have before a procedure like this, because it really is, it's a blessing. It's a big deal. It's such a positive thing.
Very much so.
Awesome. So why do you think you're not feeling anxious this morning?
Well, I think the medication does help, but other than that, I'm kind of one of those people, I research a lot. And when I do something big, I choose the best person to do it. I know they're the professional, and so I kind of just go, I trust you.
That's the
and
best.
I know you're going to do a good job. So
That's such a good attitude. I appreciate that. That's the thing I tell our prospective patients is like, trust the process. I mean, once you've made your decision on the surgeon, give yourself the credit for that research and the time, and then just let them do the thing that you need to do. So let's go ahead and mark the eyelids here. Go ahead and close for me for a second. So the incision is always in that natural crease where the eyelid folds. So go ahead and open your eyes for me for a second. You can see there's no sign of an incision there. Go ahead and close. That's a really important part of it. And then how much to remove is really the, sort of the art of this particular procedure. So So we're gonna remove some of the fat pad out of here and remove some skin. So we're gonna do a combination. So the amount of skin is just enough to remove the excess without, pulling the eyelid down. And these are the fat pads there. For the vertical restore, the incision, in Brandi's case, the direction of the lift is gonna go upward like this. All this is gonna come up. And you can see when we do that, we end up with all of this here. So we need to deal with this because that's part of the aging process too. It's all come down together. So make the incision at the level of the hairline so that we don't distort the hairline. Sometimes we will make the incision here, but there's going to be a lot of tissue that's going to come out of here, which would cause the hairline to kind of shift upward. So we don't want that to happen. And we want to keep the sideburn where it is, so the incision stays basically right there. And then there, behind the ear. All behind here. And then to some length down behind the ear here. All right, beautiful. And then we're going to enter the deep plane there. And this is all just sort of the area that we're going to be focusing on. Beautiful. So as far as the lip lift goes, we're going to make the incision basically in between the nose and the lip. And then we're going to follow this bullhorn incision design so that it stays hidden nicely. So preoperative, the lip length is about 20 millimeters, which, an ideal youthful lip is between 13 to 15. So we'll probably remove, about 4 to 6 millimeters, somewhere in that range. Let's take a look at the hands real quick. Yeah, so Brandi's hands are actually in pretty good shape, but you've noticed there's a little bit of loss that has happened.
Yeah.
Great time to do it at the same time as the fat transfer to the face. We're going to put some fat into this part of the hand just to fill in this area and also to keep it from losing volume as time goes on. And as far as where we're going to put the fat, in your case, we're just going to go underneath the eyes. Okay. So we're going to put a little bit underneath here to fill in those hollows, into the temples, above the eyelids, down around this part of the mouth, and a little bit actually in the cheek as well.
Okay, perfect.
Yeah.
Just so you can see, that's kind of where the scarring looks like at the 2-week mark. Everything else has healed up so nicely. I still have some green under eye bruising. You can see here, that's how that side is healing up. That's how this side is healing up. My lip lift is coming together very nicely right there. You can see the incision, and that just seems to get better by the day as well. I have less swelling today. At the 4-week mark, I also have less bruising. I notice that's all really coming together really nicely. So that's really a plus. I can leave the house really without any kind of makeup on, just some sunscreen, and not look too beat up looking anymore. Right now, all I have on is Dr. Karam's Trifecta, which is his skincare line. And I also have on a sunscreen chapstick. I have lash extensions on and a tinted sunscreen. because I always have to put sunscreen on. I didn't do it at all in my younger years, which is a big mistake, but now, especially even after surgery, you really want to put sunscreen on your incisions and keep those protected so they heal up even nicer. So those are the things I never leave the house, but the Illuminate from the Trifecta really gives you this beautiful glow. I love it. I'm super happy. My favorite part is that I have my jawline back. The excess skin that was here and driving me crazy in my jowl area, don't have to worry about that anymore. It's been 5 weeks since I had my vertical restore with Dr. Karam. You can kind of see my profile on both sides. As I've had a few people talk about my lips not being symmetrical, and that was prior to surgery. I have a scar line here, a diagonal vertical scar right here that was from a dog attack when I was a child. And so my lips have never been symmetrical. That's how they've always been. It has nothing to do with surgery. That's just how my lips are. So this week marks my 6-week mark of post-op vertical restore surgery that I had with Dr. Karam. My lip lift has only sunscreen on it, but you can really tell it's healing up very, very nicely as well. I've had a few people ask about behind my ears and what that looks like. To kind of get back here so you can see, it's kind of what it looks like back behind the ear. You really can't tell from behind that I've had anything done whatsoever. I'm loving the way the fat transfer has started to settle in. I was puffy for the first little while, so it took some time, but now I can really see that really nicely contoured cheekbone right there. It's been a pretty easy process. I've stayed very positive throughout the whole process, which has really helped. You just kind of have to trust the process and not freak out about things. 6 weeks in, we're looking pretty good. Like I said, I can always kind of cover this up if I want to go out with even my short hair, throw a little concealer on there, so it is very coverable, even this part. But other than that, that is how I'm healing up at the 6-week mark.
All right, so we're here with Brandi on her 2-month follow-up. How was the 2 months for you?
It's been a really easy process. I always say if I look back at the videos or the pictures, it looks really rough, but it really was very, very easy. The pain level was very, very minute. I pretty much took Tylenol and just rested, but it's been a really, really easy healing process.
It has been such a huge blessing for people to see that healing is a continuum. In 2 months, it's a lot better than 2 weeks, even though 2 weeks was awesome, right? I mean,
absolutely.
But that's the one thing I think is really important to kind of get through, is that it is a process. Let everything kind of settle into place. And even if we were to see you 6 months from now, it will even be better than it is now.
Yeah, and I notice that every week there's just still changes. And I think, oh yeah, it's looking pretty good. And then a week later, I'm like, oh wow, that even looks different this week than it did last week. Yeah. This
gorgeous jawline without any laxity here, without any squaring, is kind of the hallmark of a youthful face. Having this beautiful shape to the jawline and smooth contour to the neck. Extra skin around the eyes is gone, the lateral brows are up in better position. One of the neat things is also the proportion of the upper lip. From a facial rejuvenation point of view, it's a proportions thing, right? Right. Because aging is elongation, we're shortening everything, and if we miss an opportunity to shorten that central face, then all of a sudden the top lips look longer.
Again, I really appreciate it. It was a great decision. I'm so happy I did it. And it's been a great experience all the way through.
That's awesome. Thank you, Brandi.
Thank you.
Really appreciate it. All right, everyone, I hope you enjoyed that. That was a very, very cool experience to go through all of that footage and be able to see all those changes happening as Brandi has been going through them. And thank you so much, Brandi, for being so generous with sharing it with everyone else. I know for a fact that Brandi's #1 mission was to be able to help you guys see what it's actually like to go through recovery, what's possible, what are the transformation opportunities, and ultimately see how beautiful and natural results can be when they are done the right way. And that's a huge part of my practice, is basically helping people look as young as they feel and do it in a very natural, subtle way, but ultimately leave them feeling better and improving the quality of life and the confidence that comes with it. Guys, if you enjoyed this, make sure you hit like. If you have any questions at all, drop them in the comments. If you haven't already, subscribe to this channel. There's going to be a lot more content like this and educational material that I bring to you guys twice a week. And most importantly, I would say, be helpful to your friends and family and can share this along to bring hope to people who are going through these changes, to know that there is opportunity to help and give the best results possible. All right, everyone, thank you so much. Until next time, Dr. Amir Karam.